So, what, Mr. Love, what are you going to test me on?
Everything.
Slides. The sheep part. Okay? Do you know what the pectinate muscle looks like?
Yes.
Can you identify chordate tendon, papillary muscle? All four valves. Okay? Then, these hearts. Do you know those structures of the heart? And then, full name, what is that? No, I won't accept. S-A no. Sinoatrial node. What is
atrioventricular node.
atrioventricular node? No, some of you are talking about the ovale. That's just a little circle, but you can see it on both sides.
Isn't there another one?
Yeah, foramen and fossa. You better know that guy.
Ligamentum arteriosum.
Ligamentum
The ovale
arteriosus.
is just ovale? I thought there was something in front of it. Am I wrong?
Fossa or foramen ovalis.
Okay.
Do you know the short bundle of his? And the left and right bundle branches, and the Purkinje fibers. You can see the myocardium.
Myocardium?
Then, you saw this already. The blue is the what?
Vein.
Cephalic. The blue over here. Basilic. Here, B. What's this?
Cubital vein.
That's the cubital. You can see over here the cubital, but now for the artery it becomes the little finger. What's a bone on the little finger side?
The owner.
The ulnar. And over here it's the
Radius.
radial. You can see that these make, at the palm, venous or arterial arches. And then down here, you can see little blood vessels going on both sides of your fingers. Okay. I mean, this is easy stuff. Then, you can see, well, most of you, if you have good eyes, unlike me, right there. Can any of you see 3 blood vessels and right there a number?
23.
23 is the cephalic.
That's between the kidney. What is it between?
Then you see a little red one, and right next to it is a 26. That is a superior mesenteric. Now I want you to learn these names because when we see the cat, they're going to have the same names. If you spend the homework and learn the names on this stupid model, hopefully it'll help you on that next material. Now, down here, there's this one going off to one side. That goes to the large intestine, and that is called the caudal or inferior mesenteric. And then do you see, this is a guy here. And I know it's a guy because these are going down to his gonads. Women don't have gonads going past the groin. Some of you are saying, what are you talking about? We'll discuss that at towards the end of the semester. Your gonads don't hang.
Mhm.
So, okay. Now, here we see a Y branch. You see your your inferior vena cava blue, and your descending aorta, and you see that Y branch. Anybody not see the Y branch? Either either color, either. Whoa, that guy's looking at me. The reason for that red and blue branch is because, anatomically, because this is a critical thinking question. Because? Good. And you have how many?
Two.
Good. Write that down if you didn't know that. Now, where it branches, that's going to be called the common iliac. Now the question is, how many of you remember from the first semester what the word iliac meant?
It's crest, right? I don't
It
know.
did not mean crest.
No, that was part of iliac.
Iliac crest.
Now,
I can't think of it.
flank. Like a flanker. How many of you know in football what a flanker is?
He goes and gets the ball.
Now, you see the second Y's,
Oh, yeah, the little ones.
the little ones. The ones going outwards are going to be called the external iliac, and the one going medially is going to be called the internal iliac. How are we doing? That's so easy. Now, once it goes outside of the body wall, and how can you tell? Well, look at the bony pelvis here. And when it goes on the outside, it changes its name. It goes from external iliac to another weird name, and that name is femoral. Now, that femoral or femoral is the one that the bull goes after if you're a matador. Because if he gores you right here, you'll probably bleed out. How many of you have been to some part of the world and see bullfighting? It's not much of a fighting of the bull.
It's hard.
I would suggest a far more sophisticated Olympic event in which I've mentioned this to the first semester class. What you do is like on a, I think it's called a pommel horse. You know how you go down the runway and you grab a hold of the pommel horse.
Pommel
and
horse, P-U-M-M-E-L.
What you do is instead of having that pommel horse, you have a raging bull headed for you. You head for it. You put your hands on its horn. When it goes up, you do a couple of backflips and then land on your feet, and you have judges, like in the Olympics, rate you on how well.
No, you should jump on its back and then ride it around.
That's what I'm
No, I think it'd be better to do flips. You get a lot of deductions if you land on the bull's horns.
Yeah,
Oh, yeah.
so. Like life deductions. You lose life.
Now, some of you think I'm making this up, but there was a society living in some islands off of Cyprus who actually, if we look at their murals, that actually was their athletic event. Okay. Now, going from the femorals, coming up fairly high, is this large vessel, typically more concern for women than men, but significant for all of you because if you have a surgical procedure associated with the heart and that coronary vessels, in the olden days what they used to do, the veins had problems here, collapse, they would call it what? Varicose veins. If it was nice and intact, people having problems with their coronaries, they would cut the segments of this and insert it going into the heart, and that was known as coronary artery bypass. Bypass surgery.
I'm not looking at here.
Now, going here, back here, it goes beyond, behind the leg, behind the knee, and there's a little popliteal artery. You can see right there. And then you have your tibial. You actually have two tibials. And then they go down here, down back here, right here and here. This is important if you ever bang your tibia and you damage, because you can have something I mentioned to the people in my first semester class, anterior compartment syndrome. And one of the things that you want to do is get a nice, steady, strong, what kind of pulse? What kind of pulse? Pedal. P-E-D. And that pedal pulse, that, by the way, the vessel doesn't have the word pulse in it.